Hello everyone, my name is Osuolale and I'm going to make an oral presentation of a case of a patient that I saw today at the office. Alright, here we go. Again, my name is Osuolale and I'm presenting a case about a 16-year-old African-American male who came to my office today with complaint of right wrist pain. Alright, so I saw the patient in the clinic today and he said he's having right wrist pain and was having a fever of 104 as well. His initials are BF. Alright, so a few days ago he was playing basketball in his school and he fell. So he landed on his right wrist, right? So and he complained of pain. So they called an ambulance and they sent him to the local emergency room. So the hospital, X-ray his right wrist and they saw that he sustained a right wrist closed fracture. So as a result, so they treated him, they gave him a cast on his right wrist, and they gave him some Tylenol for pain management, and they sent him home with Tylenol and a cast. So today he was in my office, he was in excruciating pain. Boy, I tell you, he was having a lot of pain. He rated the pain as an 8 out of 10 pain, but I know that it seems the pain is so severe, like 10 out of 10 pain. So I'm very curious about this case because just to think about a young boy that fell in his school at a school basketball court and he sustained a right wrist close fracture of his right wrist, but now today he's having that much pain. There was swelling. He also complained of swelling. The other thing is I saw that his WBC yesterday was 16, so they did a blood count, complete blood count on him, and his WBC white blood count was 16. So this case is very interesting to me because I really want to see the direction of this case. I really want to see what's going on, and what the problem is. In my head, critical thinking, I'm thinking, with fever of 104, with swelling of the right wrist, with tender to touch right wrist, I was thinking, this patient is having some sort of infection because WBC of 16 correlates with leukocytosis, meaning that the patient is having some sort of infection. So I was thinking, is he having osteomyelitis? Is he having cellulitis? Or it could be anything. It could be a gout too, with this kind of symptoms. It can mimic any condition that is in that category. So I'm thinking of gout. I'm thinking of DVT. Maybe he has a clot in his right wrist. I'm thinking of osteomyelitis. Maybe there's an infection in his bone. So everything was going through my head. So this is why this patient is very important for me, or this case is very important to me. So so when I asked him what brought him to the clinic, he said the patient state, and I quote, "I came in today because I'm having pain in my right wrist that I fell on last week playing basketball. My temperature this morning was 104. I'm in so much pain," he said. All right. So I quickly performed HPR on this patient. BF is a 16-year-old African American male who came to the clinic post 4. He fell on the school basketball court 4 days ago and he sustained right closed fracture. He was transferred to the emergency room and on the same day, and the X-ray showed that he has right wrist closed fracture. So he was given cast and some Tylenol to go home. They sent him home. So right now, this patient is in front of me in the office and is so much in pain. His right wrist is swollen and he has fever 104, and also the WBC of 16 is really saying something to me that there's a sort of infection going on. So again, it described the pain as 8 out of 10 on the pain scale. The pain started 2 days ago and it's intermittent. The pain is localized, does not radiate, meaning the pain is not moving anywhere. So he said he's been taking Tylenol for pain management, but he said it's not helping, So he said activities like lifting, aggravate the pain, that it make the pain worse. And he also said that he started having fever of 104 this morning. So his CBC yesterday again was showed WBC of 16, which correlates with leukocytosis. And I did a past medical history on him. This patient has a history of diabetes type 2, but this is diet control. So diet control type 2 diabetes. That's what I saw in his past medical record. I also did a pregnancy and birth history with his mother. So BF mother is a 36-year-old female with history of 3 pregnancies. Okay, 1 delivery and 2 miscarriages. So G3P1 plus 2. So she has 2 miscarriages in the past. BF mother reported no complication during pregnancy, labor, or delivery of BF. Okay. BF was born at 42 weeks of gestation via normal vaginal delivery. BF weighs 6 pounds 2 ounces and was 17 inches long at birth. Okay. APGAR score were 11 and at 1 minute and 10 at 5 minutes of birth. BF was circumcised within 48 hours of birth at the hospital. So, which is pregnancy and birth history, everything really looks great. So, social history, I also did social history. BF currently lives with his both parents in an apartment complex. BF currently attends high school. There are no other siblings in the house. He is the only child of the family. BF mother reported that the family is financially okay. They can make their own medical copay, including pharmacy or medication copay and doctor visit copay. They can afford it. And she also told me they all have health insurance in the house. So the other thing is that BF mother works as a manager in a local restaurant, and BF mother is the main source of income in the family. Currently, BF dad is unemployed, does not have a job. All right. For safety, I also check safety in the house. BF told me, I asked him if he feels safe in the house and in the school. He said he really feels safe in the house, community, and in the school. I also asked him about safety of pool and gun. They said they do not have a pool and they do not have a gun in their house. They also said there's a carbon monoxide and smoke detector in the apartment, so that's good. So for safety wise, everything looks great. They do not have any pets. BF mother denied tobacco smoking, drugs, or vaping. She said that they are occasionally drinker with his dad, and they both drink occasionally, like 3 times per week, but they do not expose BF to alcohol drinking. Also, BF uses car seat belt whenever he's out in the car. All right. I also did a family history. BF is the only child in his immediate family. BF mother is 36-year-old African American female, and she does not have any history except previous pregnancy miscarriages. However, BF dad, who is 40 years old currently, he was diagnosed with hypertension at the age of 22 years of age. So the other thing is BF paternal grandfather is 67 years old. He is still alive and is diabetic too. Okay. Maternal grandmother died of COPD at 73 years of age. BF paternal grandmother is 68 years old and still alive with the history of gout. So now, when you think about paternal grandmother has history of gout, now I kept thinking, could this be a gout going on with this patient? Because his grands have history of gout. As you can tell, BF paternal grandfather, who is 67 years old, is still alive, is diabetic. So this patient is diabetic too. So that might be hereditary. You know, it might have some hereditary going on. So when I saw that BF paternal grandmother has history of gout, so I kept thinking, you know, maybe this is a gout. Again, I can't really make an accurate shot of what's going on until I do some investigation. So his maternal grandfather is alive at 77 years age and was diagnosed with lung cancer at the age of 49 years old. 49 years of age. BF does not have any siblings, no other disease in the family according to his mother, no mental health issue in the family according to his mother. Okay, no mental health issue in the family. I also did a review of system, all right? I reviewed the system and they are unremarkable except for integumentary system is swollen, tender to touch right wrist, redness, and very painful with open cuts. With review of system, he told me he think that there's a cut on his right wrist because he can see some pus coming out of his right wrist sometime. So I'm going to validate that complaint when I did my physical assessment. Vital signs. Vital signs are unremarkable. BP 123/79, respiration 19, temperature 97.8, heart rate is 79, SpO2 is 98% on room here. All right. So I did a physical exam. I performed head to toe assessment and it's remarkable due to a swollen tender to touch right wrist pain and open cuts. So through my physical assessment, I took down his cast on his right wrist and I looked underneath his skin on his right wrist and I saw that there is an open cut. There's some sort of laceration. The right wrist is very swollen, tender to touch. So all these are classical symptoms of some sort of infection going on. It may either be cellulitis, osteomyelitis, gout, or DVT. I don't know yet until we do some investigation. All right. So pertinent recent diagnoses include. So yesterday they did a complete blood count on this patient, and WBC was 16. So this correlates with leukocytosis. So for my assessment, my three differential diagnoses are cellulitis of the right wrist, gout, and deep vein thrombosis. Those are the three differential diagnoses I chose. All right. So resources use and critical thinking process. So as soon as I knew I'm going to see the patient this morning, so my critical thinking process was telling me, this patient has fever 104 this morning, and his WBC was elevated at 16, and he has a swollen tender to touch wrist. I'm thinking in my head he must be having some sort of infection, and I know I need to investigate right away. So if he's having some infection, I can treat that. It's very urgent and very, very appropriate to treat him as a matter of urgency. So I utilize Hippocrates to help me to arrive at my final diagnosis of right wrist cellulitis. So my final diagnosis is cellulitis of the right wrist. So now my plan. So my plan for this patient, diagnostic wise, I'm going to do some labs. I'm also going to do some imaging too. So I order a complete blood count, CBC, so I can really check his WBC again, white blood count, for the presence of infection, because an elevated WBC yesterday correlate with an infection or leukocytosis. The other thing that really gave me a concern is the fact that his grandparents had some sort of history of gout. So to rule out gout, I'm going to check his uric acid level as well. The other thing that I ordered was right wrist wound culture to determine the presence of resistance pathogens such as MRSA. So MRSA is methicillin-resistant Staphylococcus aureus. It's a bacteria that does not really listen to antibiotic for treatments like methicillin antibiotic. That's is some sort of bacteria that does not really listen to, or that does not do well in terms of being treated well with methicillin. It resists that antibiotic as a form of treatment, methicillin. I'm also going to do blood culture. Blood culture is very important too, so I can really, make sure that the patient is not being sepsis, to make sure the bacteria is not growing at a higher length in his blood, okay, like a bacteremia or sepsis. I want to make sure that too. The other thing that I'm really worried about is that I want to see if this patient is having cellulitis versus osteomyelitis, because sometimes when we see an infection in that kind of bony area, we really have to worry about osteomyelitis too, meaning that we want to make sure the infection is not really deep to the bone, because if this infection is deep to the bone, this patient is going to need more aggressive treatment. So as a result, I order 2 view x-ray of the right wrist as well. just to make sure that this patient is not having osteomyelitis. The other thing is that because I'm really suspecting DVT2, deep vein thrombosis, so I'm going to order an ultrasound of the right wrist. According to Hippocrates recommendation, I'm going to order ultrasound of the right wrist to rule out DVT, because I want to know if he's having, if there's presence of clot in his right wrist, which is causing the pain and the swelling. DVT would do that too. So we want to make sure this patient is not clotting anywhere, just to make sure we prevent some other complication like CVA, like a stroke, or pulmonary embolism. We want to make sure that this patient is not really developing other complication due to DVT or due to blood clots that would dislodge to his lung and cause pleural embolism. All right. The other thing is that I'm going to check his kidney function. Okay. The reason why I'm checking his kidney function is because I'm going to prescribe antibiotic for this patient. So I want to know that his kidney is good enough to tolerate the antibiotic. So I'm going to do complete metabolic panel. All right. So complete metabolic panel, CMP. I'm going to do that so I can check his kidney function like BUN, blood, urine, nitrogen, and creatinine level. Those are the main kidney function level that we'll use to determine if his kidney is okay to take the antibiotic that I'm going to prescribe. All right. So now pharmacologically, I'm going to prescribe, or I prescribe. So I started the patient on Keflex 500 milligram per ml 4 times daily for 7 days. That's Hippocrates recommendation. So Keflex is a class of cephalosporin antibiotic, and they're very good to treat cellulitis. So that's why I choose that medication. I'm also starting the patient, or I started the patient on diclofenac 25 milligram by mouth 4 times daily for 10 days to help with inflammation. Because on the Tylenol the hospital sent him home with, I really disagree with that, because when you think about swelling and inflammation, the best thing to use it is anti-inflammatory drugs. So which is like diclofenac that I'm going to switch that to now. So I'm going to discontinue that Tylenol they sent him within the hospital, and I started him on diclofenac 25 milligram by mouth 4 times daily for 10 days to help him with inflammation. All right. So education wise, I'm going to educate the patient to make sure they complete the antibiotic therapy, because it's very, very important to complete the antibiotic therapy. The other thing I'm going to do is to remind the patient that a good hand washing is very important to prevent the spread of infection. All right. My other education to the patient is to remind him that he should elevate that right wrist on a pillow so it can reduce the swelling. So I'm going to educate him, or I educated him to put his right wrist on the pillow to prevent or to reduce the swelling on his right wrist. So follow up. So with cellulitis, cellulitis is usually respond to antibiotic. All right. If there is no resistance going on, that's why I did the culture, like a blood culture, just to make sure we know the kind of pathogens that is going on. So if there's no resistance going on, cellulitis will usually respond to antibiotic very good. So there's not really like a big follow-up to do, except that I can check with the patient in 2 weeks just to make sure everything is fine and it's not having the signs and symptoms of cellulitis anymore. The other thing is that I'm going to make sure with follow-up, it's very important that I follow up with the chest x-ray, just because if chest x-ray come back, not chest x-ray, wrist x-ray come back, okay, that the patient is having x-ray of the right wrist come back that the patient is having osteomyelitis, that means I might need to change the antibiotic to IV or send the patient to the local ER so he can get some IV antibiotic, because we have to treat osteomyelitis more aggressively with antibiotic than cellulitis, because osteomyelitis means that infection has gone into the bone. All right. So those are the follow-up I will do. So now, application of evidence-based practice. So in this section, I did some evidence-based inquiry, and I have two peer-reviewed articles that I'm using for this section. Okay, one of them is Brown 2023, and the other one is Maxon et al. 2020. Okay, so according to Brown 2023, cellulitis case is usually attributed to open skin, redness, fever, and swelling, and those are the clinical, those are the classical symptoms I'm seeing in my patient. All right. This case study in this peer-reviewed evidence-based article validates my diagnosis of cellulitis in this patient. In addition, Brown 2023 verifies that there is evidence of high rate of cellulitis hospitalization in a patient with diabetes mellitus. Now, look at this. So the patient is diabetic, right? So this evidence-based article is telling me that there's high rate of hospitalization among hospitalized diabetic patients. There is high rate of cellulitis among them. So in my mind, I think this article validates my decision to diagnose this patient with cellulitis. And also Brown 2023 argues that analgesic and antibiotic are the gold standard to treat cellulitis. Okay, this is true. Okay, this is the reason why I prescribe the Careflex. Also, I also prescribe analgesic, which is a pain reliever, which is the diclofenac. All right, 25 milligram. So the good thing about diclofenac, like I said before, that is like anti-inflammatory. That's the best medication to treat this kind of inflammation on its right wrist. All right. Again, this validates my reason of the type of treatment that I choose. Again, antibiotic like cephalosporin, which is Careflex, and diclofenac, which is an analgesic, which is an anti-inflammatory. They're the drug of choice to treat cellulitis. So again, this peer review article really validate my decision, or really support my decision to diagnose and treat this patient this way. All right. The diagnosis approach include noting classical symptoms of cellulitis, which include erythema, warmth, tenderness, and swelling of the affected area, according to Brown 2023. That is true. So when you think about all the symptoms that my patient has, those are the things that Brown 2023 validates in this article, that when you are looking for cases, or if you want to diagnose cellulitis, you need to be looking for erythema, which is like redness, warmth, okay, tenderness, and swelling of the affected area. Those are the symptoms that I've seen in this patient. So again, it gives me a peace of mind that I'm making the right decision in this diagnosis, and also the way I'm treating this patient too. All right. The other thing is Maxon et al. 2020. The reported antibiotic treatment, elevation, and pain management are the standard of care for cellulitis. That is true. Again, in my education, I encourage the patient to elevate this right wrist on the pillow to reduce the swelling. And also, I treated the patient with antibiotic. I gave him some pain reliever. So this is the reason why I really think this article really supports my decision of diagnosing the patient with cellulitis, also treating the patient the way with the regimen that I prescribed. Okay. The last but not the least, I'm going to talk about holistic approach, as well as Gene Watson corrective factor in the care of this patient, including family collaboration. First, let's talk about family collaboration. So family collaboration is very important treating a patient. So I know the mother of this child is at the bedside with me, or is at the clinic with me. BF mother is with me, and we've been talking a lot all morning, making sure that we're making the right decision. Because when you think about Dr. Watson characters, 10 characters, one of the things that characters empower caregiver with is that you really have to collaborate with a patient, making sure the patient is your partner in care. All right. Patient is not in front of me for me to control them. We really have to work with the patient to make sure that they're really in agreement with the plan of care, meaning that the patient, as a care provider, the patient is my partner. Okay. There is so many ways of treating disease, and I really have to tailor that treatment or care plan, individually, to that patient. All right. So that brings me to holistic approach. So with family collaboration, I think I've been doing very well. Talking to his mother, making sure this treatment plan is going to work for all of us. So and I'm also going to give the patient mother a phone call after this visit, office visit. The other thing is that the principle of holistic approach. So that principle of holistic approach empower caregiver to treat the patient as a whole by addressing the physical, mental, emotional, social, and spiritual component of the uh, patient health. That is true. As caregivers, as healthcare provider, we have to treat patient as a whole. That's holistic approach, meaning that I'm really, willing to make sure that my patient is okay mentally, emotionally, socially, and physically. Physically wise, for example, this patient came into my office and start complaining of wrist pain. That's a physical need. So I make sure that I treated the patient very well. I gave him some medication. I listened to him to make sure he's not in pain. No one deserves to be in pain. So again, for me, by addressing his physical needs such as pain management and also spiritual needs, I also address his spiritual needs by satisfying his feelings of being cared for. Patient really feel grateful that I was able to attend to him spiritually. He really feel empowered. All right. Lastly, on Dr. Watson 10 characters, I'm going to pick one from Dr. Watson 10 characters. And one, being authentically present. This is the one I'm choosing, by the way. Being authentically present, enabling faith, hope, belief system, honoring subjective inner life, word or self or others. So again, I incorporated these characters into the patient care by giving the patient hope, and I accepted the subjective experience. For example, this patient is complaining of pain. That's a subjective experience. He's the only one experiencing that. So I'm really going to accept that pain. He reported pain of 8 out of 10 to me. I have to listen to him and respect that he's in pain without being judgmental of him. That I say that I really, address his physical needs. Again, his subjective experience. When you think about these characters that I just mentioned, Dr. Watson really wants us to really honor patient complaint, like a subjective. We have something in medicine called subjective assessment. That's the feelings of patient only. Is the feeling that it's only patient that can only have that experience. That's a subjective experience. So that this is what this character is telling me, that we really have to honor that. Again, his pain level, I really, like he told me that his fever is 104. I wasn't there when he checked his fever. But even though something like fever can be measured and its subjective findings, he was the one reporting to me that he has fever of 104. So a pain that is complaining 8 out of 10 to me, that's subjective experience. So this is what this character is saying. As a caregiver, my goal is not to be judgmental. My goal is to make sure my patient is not in pain. No one deserves to be in pain. So by this, I'm going to treat the patient, making sure I give him some pain medication, making sure I give him some antibiotic, making sure he's not in pain. So again, my take home is that, as caregivers, we really have to make sure we do everything possible to make sure we improve patient safety and to provide patient safety, promote patient safety, and improve health outcomes. We have to really do everything possible to do that. And the only way we can do that is not to pick up bad clinical practice. The only way to do that is to use a guide like evidence-based practice. Thank you, everyone.